Hey everybody, it's Jenny with Lip Gloss and Aftershave here to do a demo with the fabulous Patricia from NeurotriS. And we are going to talk about these gloves and the power that these gloves have for your face at home. So Patricia, introduce yourself, tell everybody what your role is with the company.
Hi, nice to be here. My name's Patricia. I work for NeurotriS, and I am the Director of Sales and Training there. My background is a registered nurse and a cosmetologist. And I also do treatments in my treatment room there as well.
Oh, awesome. I didn't realize you were also
Yes.
on.
I'm a cosmetologist and nurse, yeah, RN.
Oh my gosh, she's got it all, full package. She knows the value of all of this. So she is the perfect person to give us a one-on-one demo on how to use these because they are wildly popular. And the power of microcurrent, I think, and the popularity of microcurrent is becoming more and more prevalent.
Yes.
And maybe it's because I'm getting older and I'm seeing what's happening, but if you can prolong the results of a professional facial treatment, whether with or without microcurrent at home, it is so powerful. So with what, Patricia, I believe you said, if you are not having microcurrent done professionally and you own the PICO Toner gloves, you should do them 4 times a week?
Yeah, at least 4 times a week, but it is so safe to do every day. But come on, 4 times a week is what you should be doing.
Is ideal.
Yes.
And if you're getting professional microcurrent treatments at a location, would you just would you do the same amount of maintenance?
You know, I have, different clients that are mine, they have them, they all have the PICO Toner for home. And they'll do it once or twice a week, as long as they're getting it in there, to get and maintain that.
Maintain the results.
Yes, maintain the results.
To give everyone just a general overview of microcurrent, what is microcurrent and why is it so powerful?
Well, microcurrent actually works with our cellular level. So as we age, our cells atrophy or they just die off, actually. So the communication with microcurrent, which is very healing, just wakes everything up and just does a great thing for the face. I mean, microcurrent's been around for healing before even aesthetic purposes. So it works on those lines, it tightens and tones the skin, it helps with the lifting and the radiation of your skin, the pores, and on and on. It just does a wonderful job with so many things. And that it just even works on your, you just feel good in your mood after you do it. It's very
uplifting,
soothing, uplifting. It does. And you really love, once you start using the current, you just love it. You almost get addicted to it, which is a good addiction, by the way.
Absolutely. And what's nice about these is, a lot of handheld devices, you've got to, you do have to either be plugged in somewhere, or you have to stand and do it in your bathroom. These, I feel like you could just be laying around and watching TV. So really no reason to not have the time for it. So powerful. So I'm going to put us on a little side-by-side. And I want to tell everybody, so I have pre-moistened my gloves with just water. And then you spray the conduction spray on as well, correct?
Yes,
okay.
Gives you more conducting.
So we will spray those on each hand.
I always recommend about 10 or 15.
On each hand?
Yeah.
All right, so these are ready to go. In addition to having these pre-moistened and sprayed, I don't have anything on my face. We did a cleanse. Obviously, I have my brows and my mascara on. But we did a cleanse, and I was actually asking Patricia, is it ideal to have product on? Will this help penetrate? And for the purposes of at-home use, it just makes sense to do it on a clean face and apply your products at the end of the treatment so that nothing gets absorbed into the gloves.
Correct.
Right? Okay, so let's get started, Patricia. You just tell me, we're gonna do half the face, and then you just tell me where I should have my hands.
Okay, so typically we're going to say we want to work on our lines on our face. And a lot of people hate the neck area, so really getting in there. And I'm going to tell you, it's really important to hold in the places, especially the ones you want to treat even more.
Right. Okay.
Holding, because that current is just working that area. So you just come up and glide and all the way, because it's good to start at the neck, because let's face it, we start drooping from here down.
Right.
So we want to work it all and hold and get in under the jowls, right? And the main thing about it is we do not want to touch the gloves to each other.
Oh.
As if we do, we cancel out, because this is a negative and positive we're working here that we need to have for current. So make sure we don't touch the gloves. If you touch for a second, it's not a big deal, but for the whole treatment, you know.
And are you physically pulling the skin up?
I'm giving it some pressure, you know. It doesn't have to be aggressive pressure, of course, but yeah, I'm being firm, and that's how I do my treatments, because you want the connection with the current as well.
And how long do you hold in each spot? So would I do like one lap and then another lap, or would I be doing like a hold for an extended period of time?
You know, when you have an aging person who needs more lifting and more work, I like to hold for like 10.
Okay.
To really get under there for like 10 seconds, you know, and then move up. Okay. You know, this is like when we, you know, we're treating now the skin area where the lines in that are, going under the eye as well. And you can do just a nice little move. Now you don't have to, I just want to point this out, that you do not have to have the whole hand on the face. Okay. Just like this, if you have two, just like this, you're getting it worked.
Oh, wow.
So the whole point is that you have to have the positive and negative of both gloves, because they have to be on the skin to connect, and to complete a circuit to work.
2 fingers. And
you can just go like this for lifting and get under there and erase under the eye and hold that area, because people have crow's feet. They have those fine lines underneath the eye. You can get right above where the eyeball is and work that, where people get crepey eyelids as well. So this can really treat those areas.
Or if people tell you that your eyebrows aren't even, like.
Yes, that's true. Yes, because people have that ptosis, they call it, you know, where one side is droopier than the other. You can actually really work it out on your one side and lift it to make it more even for both sides.
Question, obviously we see a negative and a positive. Does it matter which is on top?
Not with the gloves, it does not.
Oh, so it's less to think about when you're at home. That's amazing.
It is, because you can really do this too. So just to point it out, you know, you don't have to. So it does make it easier for you're not going like this, right? Yeah. You can really just work it and work right underneath that eye, you know, and hold it. You want to hold. You can nicely glide and then hold it.
All right. I like that gliding motion. It feels like you're doing. Is this good for puffiness?
Yeah, I mean, we all have the puffiness for different reasons underneath the eye. Now, if it's like the fat pads that people get, that's harder. That's almost like a surgical thing. But you can work the forehead with those lines, really. Yes. Which are nice.
I do have those lines.
Oh, good. You can really work them out either going this way, right? Or moving up. You know, really
a lot of forehead to work with too here. So, so you slide out too.
You just don't want to go downwards when we do this treatment, because everything wants to be lifted up. We already went downwards. The sag already pulled us down. So we always want to stay upwards, right? And you can really get a nice eyebrow lifting, right? Really open those eyes. It's amazing how you can just open those eyes and you feel so refreshed and good. You really do. You really do.
Now, did we talk about having a slight metallic taste in your mouth?
Yes, you can have in one of the programs, you know, we have like 6 signatures in here, just to let you know that every 10 minutes it changes to a different signature, frequencies, I should say.
Okay.
So the first part is really mainly targeting your lines and your toning, and the last 10 is a lot on your lifting, where you're getting that facelift per se. You're lifting everything up. So if we really get under here when we're doing the lifting, we really want to get under that muscle and hold it there. That's where you're going to get that lifting of all this. So you just get under. We call it a cinch, but it's almost like, you know, you're getting under there, the muscle, and you hold that area because that current's going to work that. So if you have a lot more sag, I should say, or a lot more droop going on, I think you should hold it for 10 for sure. Now, I'm a true believer. People, when they're 20 years old, should start this. If I knew this was out there at 20, I would have done it. It's
with these. I'm like, if this is all I have to do to keep my face intact for the next 40 years, like, okay.
If you use it honestly, faithfully, and stick with it, it will work. You will maintain your youth with much longer than not doing that.
So simple, you guys. And I've got to say, the beauty of these and why I'm so excited about these is because I realize in a lot of areas, microcurrent, finding a professional that can offer microcurrent, it's not easy. I know in my area, there was a few women I was talking to about this, and they're like, wait, what is it called? So they've heard of the term microcurrent, but they've never heard of, you know, places you can go to get these professional treatments, which we've all seen the before and afters that are amazing. So having these and just committing to 4 days a week for how long should each session be?
Well, the sessions are 30 minutes for P1, which again targets the fine lines, the toning, and the lifting. P2 helps with collagen, elastin, and much more. I mean, it just gives you that nice, beautiful radiance. You're going to know a difference in your color of your skin and your pores. Quite amazing.
Wow. So, you guys, this is literally it. This is all you need. It comes with a nice wristband to hold the what is this called?
PICO Toner.
The PICO Toner unit.
Yes.
Right here, so that it's not, you know, unplugging like it just did. It comes with gloves, and that was another thing I wanted to talk about, Patricia. It comes with a bag of these insert gloves that you guys can hear. Why would you choose to wear those?
Okay, the insert gloves are if you just want to treat one area, like your face. So if you wear the inserts, it will only treat your face. You're allocating everything there. If you do not wear those inserts, then you get a hand and a face treatment. So you're getting 2 treatments, and you might have to turn the intensity up more just because you are treating 2 areas now. You're sharing the treatment with your hands.
Right, but to me, why not? Like,
yeah, exactly. Why not?
Also aging back here. So when you purchase the PICO Toner gloves, which retail for, what is the retail value?
$5.95.
$5.95. It comes with an amazing instructional video, much more intense than what we're doing here today. Tony, Tony's the owner of the company, and will go through, tell you how to turn the machine on, how to put the gloves on, how to get the gloves wet. It is step by step. It is foolproof. You cannot go wrong. So you'll get a much more detailed video on how to use the gloves. And you can always reach out to us, to Patricia. They are extremely responsive on techniques, tips, tricks, anything you need from NeurotriS. We love these gloves.
Yes, they're fabulous.
So we will put all of the contact information out for you guys of where you can get in touch with NeurotriS. And thank you so much, Patricia, for coming on today.
Oh, absolutely. Thanks for having me.
In the demo. We'll be wrinkle-free in 20 years.
That's what we want.
Thanks, guys.
Bye.